We are undergraduate researchers under Dr. Katharine Simon's sleep lab. My name is Brandon.
I'm Michael,
Hi, I'm Isa.
I'm Katie.
and our UROP research project studies how detailed composition impacts credibility of patient narratives. Have you ever seen someone struggle to be taken seriously by a doctor, either due to the way they explain themselves or because they just didn't quite know how to explain what they were feeling? For me, it was a family member. It's harrowing to think about how we underestimated the underlying seriousness of the symptoms and how if she had communicated her symptoms differently, her doctor might have caught the warning signs sooner. But the reality is that we did not know it was cancer until it was at a much later stage. And for many others, they find themselves in similar situations as well, where there's always a chance for an earlier diagnosis and a better outcome.
And these experiences are what motivated us to explore how the way patients tell their stories can affect their healthcare. Me personally, working at a pain management clinic, I'm constantly speaking with patients regarding their symptoms, and it's important to listen and communicate effectively to relay that information to the doctor. This environment requires accurate and efficient communication, as that it could be the difference in the care that the patient receives. The doctor usually speaks with patients to understand their history and lifestyle, symptoms, prior experiences, and treatments. As most of the stories are patient experiences, they must try to clearly communicate what is wrong and what they felt. This all comes together to further treat the patient, like ordering the proper imaging, receiving the right medication, and figuring out the next steps. If a story doesn't really seem credible, doctors might overlook something important or not get enough information to properly treat the patient. For us, we were especially interested in pediatric care, where young patients can't always explain their symptoms clearly compared to adults, and that can lead to miscommunication or even misdiagnosis.
So, our research looks at patient stories and asks, does the way a story is told change how credible it sounds? We created short fictional narratives that mimic how real patients might describe their symptoms. Each story is a little different. Some contain more episodic details and some contain more semantic details. We then ask people to rate the stories on factors like how believable or how accurate they seem.
It's research for our undergraduates for our pilot, but our next step is to eventually extend this research to physicians. In the long term, we hope our findings can raise awareness about cognitive bias in healthcare and help improve communication between patients and providers. Because at the end of the day, every patient deserves to be heard and believed. Thank you for your time.